All right, today we're going to talk about the most important white blood cell. Now, this is just my own viewpoint, and I'm going to tell you why. Now, there's quite a few different white blood cells, but the T regulatory cell, I believe, is one of the most important ones. Another name for the T regulatory cell is the T suppressor cell. Same thing, and you'd probably see it as Treg, T-R-E-G for short. And if you wanted to know the full name of it, this is another name that you can look for, not that you would ever be interested. But what's unique about this white blood cell is that it pretty much does the opposite of what all the other cells are doing. It is suppressing the immune system. It is producing anti-inflammatory cytokines. It keeps the balance, okay? It keeps the immune system from overreacting. It ends the immune infection. It lowers mucus. Pretty much almost all the other immune cells are producing more mucus, producing inflammation, killing things. This guy is all about chilling things out. So really, it does two main things. It suppresses the immune system. And number two, which is very important, it regulates self-tolerance. Now, what does that mean? That means it prevents your body from developing antibodies to itself. They're called autoantibodies. So it basically prevents autoimmune conditions. So to do that, it has to identify the good guys from the bad guys, and it can't get confused. So without this cell, you would develop antibodies against your own tissue and have a lot of inflammation. So if there's a problem with this cell, the person develops irritable bowel disease, type 1 diabetes, which is an autoimmune, MS, rheumatoid arthritis, asthma, and even the cytokine storm, which is the actual reason why certain people are dying of COVID-19, those people that have a very weakened immune system. So apparently when you have a weakened immune system, this is the weakness right here. And then the other parts of the immune system are in hyperdrive. They're doing massive destruction, creating a lot of collateral damage to the tissues in the body. That's very, very interesting, but then how can we strengthen this cell right here? Well, it just so happens there are several nutrients and things that are intimately involved with this cell right here. If you are vitamin A deficient, this cell will malfunction. You won't have enough of T regulatory cells in your body. And it's interesting because vitamin A supports the mucous membranes. In fact, that's where certain inflammatory reactions can occur too, right below the mucus lining there on the inner skin. So vitamin A is a real key factor in supporting the immune system. And then we have vitamin D. Vitamin D by itself is anti-inflammatory. But if you're deficient in vitamin D, these cells just do not work correctly. Now, the T stands for thymus because they're produced in the thymus gland and they get their training in the thymus gland. So anything that goes on with the thymus gland that shrinks it or causes it to atrophy will cause a problem with this cell right here. And it just so happens that thymus atrophy occurs when you're deficient in zinc. Also, if you have a lot of stress and you activate cortisol for too long, that can also shrink the thymus. Not to mention, as you age, the thymus shrinks. So that's the relationship between age and your immune system. You get more inflammation. You're more at risk for the cytokine storm. Then we have something called DHA. This is an omega-3 fatty acid. If you're deficient in this, these don't work that well. Probiotics. Now, if you think about it, children that have had a lot of antibiotics early on really have a problem with increased risk of asthma, diabetes type 1, irritable bowel syndrome, a lot more inflammation, allergies. Why? Because your friendly bacteria are part of the immune system. So one thing that's very, very important is to make sure you have enough of the right bacteria. And then we have the factor of gluten. Gluten has been known to interrupt the regulation of this cell right here, which makes sense because certain people develop antibodies to gluten, which creates an autoimmune problem called celiac, which is an inflammatory condition in the bowel. So now we're dealing with autoimmunity again. Now, in the study that I'm using to validate this information, which I'll put a link down below, they also had to add in there a high-fat diet weakens the Treg cells. So I had to look that one up because I find that hard to believe. And I found that the high-fat diet that they used with this rat study was from Bioserve, okay? It was a product F3282. And if we take a look at exactly what they ate and what the high-fat diet was, the carbohydrates were 35.7%. A true keto diet is only 5% carbs. So yes, this is a high-fat diet, but it was also a high-carb diet as well. And the reason I say that is because the fat was 36%, almost the same as the carbohydrate. So it was a high-carb and high-fat diet, which we know if you combine carbs with a high-fat diet, you're going to create a massive problem with the body, especially with the spike of insulin, which would then suppress the immune system. You would have a lot of dysfunction. And then if we go down to the ingredients, lard, casein, maltodextrin, which is the worst sugar of all, sucrose, mineral mix, vitamin mix, and of course these were synthetic, methionine, choline chloride. So you can pretty much just scratch off a high-fat diet because they really did not use a keto diet. They just use a combination of high fat with a bunch of other sugars, which you would never feed anyone in a million years. These are the things right here that you'd want to focus on to support one of the most important white blood cells, which is the T regulatory cells. And if you haven't seen my video on strengthening the immune system, I put it up right here. Check it out.